Plus, do you want cheeks like a supermodel?
Look, it's not liposuction.
A smile like the stars?
And in 45 minutes, you get about 8 shades wider.
We'll tell you how.
Things look a little bit different today. We've got cosmetic dentist Dr. Bill Dorfman sitting in with us where Dr. Sears usually is, but he's noticeably absent. Thanks for being here.
Thanks for having me.
Always great having you.
Yes.
Now I want to turn to some hot headline-making news. Now, I know you're the dentist behind a lot of celebrity smiles, Britney Spears, and a lot of people want to know how these celebrities have such beautiful smiles and beautiful white teeth.
Well, you know, Britney actually has really nice teeth, but they needed to be a little bit wider. So what we did was we used Zoom whitening. Zoom is an in-office procedure dentists do. We helped develop that system. It gets your teeth about 8 shades wider in an hour, and it's phenomenal.
So how does that work? In an hour, 8 shades wider?
Yeah, it's pretty
what's so
easy.
special?
What you do is you just sit back in a chair. We put this gel on. It's a hydrogen peroxide-based gel. We activate it with this metal haloid light that makes the process work faster. And in 45 minutes, you get about 8 shades wider. And the best thing about it, it's totally safe. It doesn't make your teeth weaker. It doesn't hurt them. It doesn't. All it does is takes out the color.
What's the cost of something like that?
It's about $300–400.
So let's say, you know, Drew and I want to whiten our teeth.
Of course we do.
We don't want to go spend $300–400 or a day at the dentist's office. Do these over-the-counter products work? Because I'll admit, I buy the whitening toothpaste.
Right.
I don't know if it's working. Do the
It
strips
doesn't.
work?
It does. The problem with whitening toothpaste is it really doesn't whiten your teeth. It might make your teeth look a little bit whiter because you take off some of the stain, but if you really want to whiten your teeth, you have to use something with carbamide or hydrogen peroxide. Now, some of these over-the-counter products do work a little bit. So you can probably get your teeth 3 or 4 shades lighter if you use the strips. So they work a little bit. But if you want to get your teeth their whitest and you want to make sure it's natural and safe and healthy, go to your dentist. The other problem is caps don't bleach. So if you have a capped tooth on the front and your teeth whiten, all of a sudden that's going to look dark and your other teeth are going to look really white next to it. So you have to be a little careful.
That's a problem. So, Bill, big smile for us. See, those are some nice teeth.
Well,
you know what you're talking about.
Everybody's just what you
So
peel this off.
How long, Bill, do these take to work?
They usually take like 4 or 5 weeks to really get them white. That's why Zoom is so great, because in 45 minutes you get an average of 8 shades wider. You walk out, you're done. You sit back, watch a movie.
How does it feel?
How's it taste, Drew?
It's all right.
Really?
I mean, it's not foie gras, but it's okay.
It's like a retainer. So I know that you have plans during the show today to do a little $1 million smile makeover.
We are actually $1 billion. We've got Billy here.
Million's not enough. We're talking billion.
Billion. Can we
on
show
Billy.
a picture of Billy's teeth before?
I'm going to wipe my teeth here.
There we go. So here's the deal with Billy. He wants whiter teeth. That we're going to do with Zoom. And then all those gaps, we're going to lose them. He doesn't like the gaps, so we're going to turn him into kind of a Hollywood leading man look. He probably likes working with Ariane, too. Look at Ariane. She's got the most beautiful smile ever.
Yeah, if you could,
Absolutely.
if you could give me her teeth, that would be great.
You know what, Billy? We're going to do that.
One of the take-homes here is that if you have, you know, a sore in your mouth that doesn't go away, you have to have it checked out.
Actually, the rule is 2 weeks. If you have something in your mouth that is not gone in 2 weeks, you need to get it looked at, and most likely biopsied. So 2 weeks is the rule of thumb.
But it's a good message.
You know what? It's up to us. You have to have your dentist examine you for oral cancer. It's our job. It really is. Do you know that 25% of new cases diagnosed are not in high-risk groups? They're not smokers. They're not people that use alcohol. They're people who really shouldn't have oral cancer. So you really need to make sure your dentist diagnoses it, because early diagnosis is the key. Basically what we do is we incorporate this into their hygiene appointment. So when they come to get their teeth cleaned, we have a machine called the Velscope, which we'll demonstrate in a minute, in all the hygiene rooms, and we do an oral cancer screening every time the patient comes to our office.
So tell us about this, because your symptoms were a sore throat.
Not even the sore throat, that went away. It was really a painless condition. and it looked normal. The tonsil was large, but it looked normal.
Well,
So
here's
how
the
does this-
scary thing. You know, there are 3 times as many cases of oral cancer as there are cervical cancer. And it's really hard to see. When you look in the patient's mouth, you don't always see this. It's not visible to the naked eye. There was a system that was out for a while where you use these dyes and rinses and all that, but they were messy and hard to use. The Velscope's really easy. It's basically a light, and we shine this light in the mouth. In fact, we're going to get Dr. Drew to demonstrate this for us here. So
Bill,
we push this little light here, and we move the tongue aside. Most of oral cancer is on the base of the tongue. And when I look through this light, what I can see is I see a fluorescent green on the natural tissue. But any dark tissue is precancerous or cancerous or something suspicious that we need to look at.
Thank you so much, Teresa.
Absolutely. You know, as a patient, when you go to your dentist, if they don't do that, you should ask them, would you please examine me for oral cancer? And ask them to use the Velscope. I think this is really the best system on the market today.
As you can see, Dr. Dorfman has started Billy's $1 Million Makeover Smile, one of the simple ways to transform your body in under an hour. Dr. Dorfman, how's it going back there?
It is going great. We're just getting wider by the minute here with his teeth.
Billy?
Yeah? Are you with us?
Yeah.
You hanging in there?
He's doing great. He's a great patient.
You're looking good, buddy. Well, thanks, Dr. Dorfman. We'll check back in with both of you later, and we'll see Billy's brand new smile at the end of the show. But Dr. Dorfman is working on Billy's smile makeover. So, Bill, you whiten his teeth, and now what are you doing?
Now we're doing the bonding, and we're just about there. It looks awesome. I think Billy's going to be blown away when he sees what we're doing here.
Well, thank you, sir. We'll see Billy's final results later. So tell us what you did to make this happen.
First of all, we did the zoom whitening. We got his teeth about 8 shades wider, and then we did bonding. And the thing that's cool about bonding, no shots, no pain, fast, easy, really affordable. It's about a few $100s to do this, and it gives him, like, seriously, a $1 billion smile.
So when you say bonding,
What
does that
bonding
mean?
is we use material. It's a tooth-colored resin. We hit it with a very high-intensity LED light, and then that resin turns from a paste into a hard material, and that's permanently hard.
so it's permanent. You're basically shaping it around the existing teeth.
Absolutely. It will last for about 3 to 5 years.
Over there is is that the laser or the LED light?
Yeah, let me show you how bonding works. We have a paste. It's a tooth-colored paste. It's a resin, and you can see that I can kind of squish this around. So what we'll do is we'll hit this with this high-intensity light. This is called a little flashlight, and basically we hit it on there for a few seconds, and this polymerizes, and what it does is it basically turns it hard. And now if you see, if I try and cut this, I can't cut this. It's a hard material now.
But if you were shaping it and something went wrong, is
could
there a way
just-
to get rid of it?
Yeah, we could just rebond him again. I mean, it's totally reversible. If you don't touch the teeth, it's totally reversible.
And you're going to do 2 things, right? You're going to give him those glasses he was wearing.
Right, the glasses are killer. But the one thing you have to be aware of, too, bonding isn't great for everything.
Right.
It's great for small chips, for small spaces. If you have a little decay at the gum line, bonding's perfect. But if you need to have more done, you're probably going to have porcelain or veneers or something else like that. You know, this will last 3 to 5 years. If you're really careful with it, I've seen it last up to 20 years.
And the veneers, they are more expensive than this couple $100 procedure.
And it's a much bigger procedure.
Okay.
But I have a gift for you, Billy. This is your before and after here. You could take this home as a little memento.
Thank you so much.
My pleasure. My pleasure.
Thank you, Billy.
Thank you.
Thank you, Dr. Dorfman. Appreciate it.
All right. Thank you.
Dr. Dorfman, I also know they do something else.
Yeah, it's actually good for toothaches. Not great for dates, but just put it in, squeeze it out. Oh, that's bad.
I hope you don't have a date tonight, do you?
I feel like Jim right now. Doesn't he have to do
Yeah,
this
exactly.
stuff?
Jim, just
take
come
one.
on,
Come
Jim.
on.
I got a date tonight.
If you ask him nicely, he'll eat the whole thing.
I want to thank all of our guests today, especially Dr. Dorfman, for co-hosting with us. For more information.